If you look at the cerebral vessels, we put the transducer near to the base of the scalp, and different characteristics are important dependent on the measured blood vessel due to their origin. We need to know where is vertebral artery and where is the carotid while scanning the neck. We can scan the neck of the fetus, especially for carotids in anencephaly. The mid-cerebral artery vessel of choice, easy to find it, most representative, here it is. So we will look for circle of Willis, and then we will find two middle cerebral arteries. Here it is again, the circle of Willis. And you can see the anterior cerebral artery. This is again anterior cerebral artery, the small anterior communicating artery, then the ophthalmic artery, smaller one, the anterior choroidal artery. These are the internal carotids. And then we have got the posterior cerebral. Here it is, the posterior communicating artery. And this one is the middle cerebral artery. So very prominent. We can see this circle, the interior, posterior, on one side is the internal carotid, and then outside the villi, outside the circle of Willis, we have got the middle cerebral arteries. These are the middle cerebral arteries. Here again, we can see these are, here will be the middle cerebral arteries. On ultrasound, it looks like this. So we have to take the center of this vessel. Indications for middle cerebral artery Doppler includes IUGR when the expected fetal weight is less than 10th percentile for gestational age, fetal anemia like fetal hematocrit varies with gestational age, called severe when head circumference is less than 15%. Cerebral malformations like color Doppler of circle of Willis and branches also help in evaluation of cerebral malformations. It reflects the middle cerebral artery here. This is the second one. So it reflects the cerebral flow and rising PI after a nadir. So in the spectrum, you will get a nadir, and then there is a rise of the pulsatility index. This is on 3D power Doppler. Here is 2D with power Doppler. And we can easily find these vessels, not difficult to locate. The isolation angle is important. Although the indices are not angle dependent, velocities are dependent on angles, but we try to keep it near to 0. So here it is. You can see the early systolic. This is the peak systolic. Then comes the diastole, and we have got the end diastolic. So it is biphasic flow. Here is again another scan of middle cerebral artery on power Doppler. Little diastolic flow seen in normal fetuses. The rule of thumb is that it will be almost less than half of the systolic. The diastolic will be 1/3 or at least half of the systole in normal cases. So slight increase in diastolic flow velocity with advancing gestational age is seen. So it is usually 1/3 to 40%, but with gestational age, it increases a little bit. we are talking about diastolic.